Okay, we're looking at the male reproductive system today. Here we have the scrotum, which is a sac of skin outside the abdominal pelvic cavity that houses the testes. Here we can see the testes, which are our primary sex organ of the male, also called the male gonads. This pink structure here that runs up and into the scrotum is the epididymis, which is a storage structure for the synthesized sperm made by the seminiferous tubules. Okay, then we have this tube that runs up, around, and along the bladder, which is called the vas deferens. Back here, which you can't really see, but there is a widening of the vas deferens right about here, which we call the ampulla. Together, it joins with the seminal vesicles, which is the structure right here, to form the ejaculatory duct. This purple structure here that we're looking at is called our prostate gland. The prostate gland has secretions that about 30% of semen is a viscous alkaline fluid. It also receives the contents of the ejaculatory duct, which are sperm, testicular fluid, and seminal fluids. Okay. This cord is wrapped around what we call the spermatic cord. The spermatic cord consists of the lymphatic vessels, nerves, and blood vessels, and vas deferens. Together we call that somatic cord. We're not going to see it on this model, but we have an inguinal canal, which is a passageway through the abdominal wall that the vas deferens enters into the abdominal pelvic cavity through. Again, we have the seminiferous tubules, which we can't really see in this model also, which are going to be entering into the inside of the scrotum, which synthesize sperm. Okay, then if we take this off, one other thing, we have the muscle sheet right here that supports the urinary bladder, which we call the pelvic diaphragm. Inside, we have, again, this part right here is the urogenital diaphragm, and the little tiny piece that runs through the urinary or the urogenital diaphragm of the urethra, we call this the membranous urethra. So this little section right here is membranous urethra. Okay, then we have a muscle wall right here that surrounds each side of that membranous urethra called the external urethral sphincter. Okay, moving on, we have again the prostate gland here with the ejaculatory ducts. Running through the prostate gland, we have a prostatic urethra. So from about here to here, we have the prostatic urethra. Okay, so going on, we have the bulbourethral glands, which we are not going to see on this model. Going into the penis itself, running down from the bottom of the membranous urethra all the way to the what we call the external urethral orifice, we have the penile canal or the spongy urethra. Okay, and surrounding this we have the corpus sponginosum, which is this pink tissue here that runs along both sides, and there's actually only one of these, and this is erectile tissue in the penis. Then we have this tissue here, which is again erectile tissue, which we're going to call the corpus cavernosa. Both of these fill with blood, the cavernosa to a greater degree than the sponginosum to have cause the penis to achieve an erection. Okay, so the sponginosum down here, this bulge we call the glans penis. On the outside, the fold of skin that we look at from the outside here, that's often removed during circumcision is called the prepuce. And that about does it for the male reproductive system.